governments around the world are grappling with managing the coronavirus pandemic. Another problem, however, is quietly emerging. Experts are calling it a secondary epidemic, but this time it will be the psychological impact. Kenya's mental health space has been governed by a piece of legislation that is now 3 decades old. Senator Sylvia Kasanga is the mind behind the Mental Health Amendment Bill 2018 that is yet to be passed. We speak to her now to find out if the new bill will in part address the impending wave of psychological cases in the pandemic's aftermath. Senator, thank you so much for joining us this evening. Just the first question, what are some of the existing gaps when we talk about a mental health law that has been in place since 1989? All right, we appear to have a bit of a technical hitch with the senator there. If you can get her sound up. Senator, can we get you again on that question? What are some of the gaps in the existing mental health law that really has been in existence since 1989?
Thank you so much, Victoria. I hope you can hear me now.
Yes.
1989 is the last time anything mental health legislatively has happened in this country, and that's a long time ago, Victoria. And our constitution today is a beautiful constitution. Article 43(1)(a) guarantees every person the right to the highest attainable standard of health. And Section 73 of the Health Act 2017 obligates Parliament to enact legislation to ensure the rights of individuals suffering from mental disorders and conditions that are protected, and mental health hospitals with sufficient capacity are established at both national and county levels. So the first thing, Victoria, you can see is the biggest gap is that we don't have any legislation that ensures that mental health is taken care of at both national and county level, which is what our new constitution has envisioned for Kenyans to have. And this is the first thing that the Mental Health Amendment Act 2018 is seeking to address. Health is a devolved function, and mental health has to be at home in the county governments. A huge portion of how to have this act rolled out is actually laid with the county governments, Victoria. So that is the first thing that is the biggest gap with the mental health.
So beyond decentralizing mental health care to the counties, what more does this bill, seek to do?
Oh, a lot more. Victoria, I could speak the whole day when it comes to this. A very comprehensive bill. We are looking at the rights and the human rights approach to dealing with mental health for our citizens, those who are living with and those who are also beginning to suffer from mental health. We are looking at making sure we have enough psychiatrists, we have enough nurses, we have enough workforce to do with mental health at both the county and national level. We are also looking at the capacity of our county governments to be able to handle mental health. We are also looking at fighting stigma. And fighting stigma is a very big portion of dealing with mental health. As you know, there's a lot of stigma that is held when it comes to issues of mental health. We are looking at how do we fight stigma from education, early childhood education, how to make sure our curriculum encompasses dealing with mental health from a very, very early age. Victoria, there's so much about this bill that I would love to speak on. And we are looking at issues of as well as access to mental health care, rehabilitation, and treatment for Kenyans. And all this was missed out in the 1989 bill, and that's what we are trying to do in this current bill, Victoria.
You mentioned the personnel gap, which is huge in this country. We simply don't have enough psychologists, psychiatrists, and counselors. And I'm only imagining once the COVID-19 pandemic passes and, we're kind of preparing for this psychological impact. Many people will require these services. We will not have enough. And you're talking about people who have to go to school and training for this. Is there any plan in the interim to address that wave of mental health cases that could come?
Victoria, in the wake of COVID-19, I think it's important that I let you know that I am sitting now in the COVID-19 ad hoc committee that was just constituted by Senate when we sat to about a week and a half ago. I'm actually the vice chairperson, and this is the one thing we want to address when we meet the CS together with the National Emergency Response Committee, because we are curious to know what is the overall approach they're going to have with mental health. It is true we don't have the capacity right now, and the question is, how then are we going to deal with the escalated cases that we're going to have? Victoria, as it is, before even COVID-19, 1 in 4 Kenyans suffer from mental health illnesses. 1 in 4, and that is a statistics that we've been given by the World Health Organization. Now, with the effects of COVID-19, the loss of work, the loss of income, the fact that you're not able to say goodbye to your loved ones because now we are quarantined. You cannot go for funerals. You cannot say goodbye. If we're going to go by what we are seeing in other countries, a time is going to come when we are going to have so many affected cases. And how are we going to deal with all this? There's the anxiety that comes with the whole COVID-19 situation. I'm at home. Am I sick? Am I not sick? My parents at home, are they well? I cannot see them because I'm in Nairobi. I am cut off from up country. All these anxieties are going to come with an escalated number of cases. Already, when I speak to Mathare, because I've been in touch with Mathare Hospital very closely, we already have cases of Kenyans who are breaking down when they're in quarantine, because we've had a lot of issues with the situation of the quarantine centers, and they've been sent to Mathare. Is Mathare prepared to take care of cases that are being sent to them who have been on quarantine, who break down, and from any other cases above? Is Mathare capable right now of handling any other cases of Kenyans who are seeking mental health treatment, whether COVID-19 or otherwise? Are the staff there empowered? Are they carefully, I've had today the governor, the COG chair at government, what's his name, Governor Oparanya, has just mentioned today how we need to take care of our caregivers, the frontliners. And my worry is, are the caregivers at Mathare empowered to be also frontline? Because we still have cases of people living with mental illnesses who have to continue going to Mathare, and we may have new cases. So are the caregivers in Mathare empowered to handle any COVID-19 cases? We have all these things in our minds, Victoria, and we are really looking forward as a committee to engage with the National Emergency Response Team when we meet them, Emergency Response Committee when we meet them, because we want to know what is their overall view. When it comes to mental health, we know there's going to be an escalated number of Kenyans who are suffering. 1 in 4 already is a statistic. We expect that statistic to be higher. Are we prepared, Victoria? I don't know. I need to know. I need the government to tell me, are we prepared? Already we don't have much. The budget that has been allocated for mental health has been minuscule over the years because of the lack of legislation. There's been no avenue to ensure that there's enough money going specifically to mental health. So what is the government trying to do? I know there's been steps, Victoria, since last year. There have been steps. We had our first mental health conference that was held by the government, of course, with help of WHO and a few other stakeholders. And that led to the president speaking to it. And we had a committee for mental health that was formed, a task force that went around collecting views. I have not seen their report yet, but I know their report is ready, and we're waiting to hear what their report says. Is that going to be adequate to deal with the pandemic that we have here today? Victoria, I don't know. I am waiting so much to engage with the emergency team so that we can know how ready are they, because Kenyans are going to need a lot of support. Our caregivers are going to need a lot of support themselves, mentally, as well as all the other support that Governor Oparanya was talking about. We have to give our caregivers, frontliners, a lot of support. Then Kenyans themselves need a lot, and we are looking forward to engaging with them on this.
All right. And Senator,
Thank you, Victoria.
Before I let you go, you mentioned something really important, which is funding. And I heard you speak in a different forum about how the budget for medication at Mathare Hospital was slashed from 17 million to roughly about 2.6 million in the 2017-2018 budget. And which brings me to the question, when will mental health care be taken seriously in this country? Because when you talk about a government taking something seriously, you see where they put their money. And that certainly is not going to mental health care. Is the bill seeking to boost funding to that particular sector, and how?
Thank you, Victoria. Sections of the bill are actually calling for both national and county governments to have specific budgets for mental health. We have not specified the amounts that it should be because it's a bill coming from Senate, and Senate cannot emanate bills that are money bills. As you know, we always have this tussle of money bills and not money bills. But we have recognized that there is no health without mental health. So there cannot be a health budget without securing a mental health portion of it. And Victoria, I am happy we have CS Mutahi Kagwe is the real deal, and we are looking forward to engage with him because all those people who are mental health advocates and practitioners like myself, we are happy that Mutahi Kagwe, we can sit with him and tell him there's no health without mental health. And it's about time now that we seek to fund mental health as it should be. And part of the bill, Victoria, that I need to highlight on is that we are not looking for establishment of mental health facilities. Other than the referral hospital we have, that is Mathare, and level 5 hospitals, we are actually seeking to have mental health to be integrated alongside with the entire healthcare system. We want psychologists, psychiatrists, counselors to be part of the healthcare system. And that's how it should work, because we're also trying to fight stigma rather than having stand-alone hospitals, if you know what I mean, because that will then just escalate the stigma. And Victoria, if the government looks at it like this, then we want caregivers at all levels. We want caregivers, mental health caregivers at level 1, level 2, and those are basically, and up to level 3 are county government staff members. Actually, county government is the one that is supposed to ensure that level 1, 2, and 3 have mental health caregivers, as well as community-based healthcare workers. And then level 4 and 5 are national government caregivers. So this is what we are going towards. And once we have enough caregivers for Kenyans, we will start seeing, the impact that we want to see in mental health.
Wonderful. Thank you so much, Senator. And just quickly, when do you expect that bill to be passed? Because that's critical.
Yeah, Victoria, the bill has already passed Senate. It's now at the National Assembly. It is at the committee of Honorable Sabina Chege. That's the Health Committee at National Assembly. They've already done first reading. They did the public participation. I know the report has already been filed in Parliament. And God willing, as soon as Parliament goes back and resumes, we shall be going to second reading. It's a beautiful bill, and it's a bill that has received a lot of praise and accolades across Africa. And they're waiting to see once it is passed, because it's a role model.
Right.
It's a role model on how we should deal with mental health. Yes.
Thank you so much, Senator, for your time. And on that note, let's take a short break here on Citizen Weekend. Let me leave you with a number as we go to break. 2.6 billion. That's the number of people who are in some form of a lockdown around the world. What is going to be the state, the mental health state of these people once released back into the world? We have a conversation with Dominic Mwangi, a psychologist, to break it all down for us. Send your questions, SMS 22422. Tag me on Twitter at Vicky Rubadiri, at Citizen TV Kenya. And of course, the hashtag is Citizen Weekend. We'll be right back.